You remember Ricky. In 1972, his mother brought him to the Shriners Hospital in St. Louis. And it was here Ricky was given a new way of doing things, a whole new chance at life. Remember how much Ricky liked ice cream, how well he learned to feed himself, how he compensated for the arms he didn't have by using his feet? Well, the Shriners had a better way. They fitted Ricky with a pair of arms, and because anything new takes a little getting used to, they worked with Ricky and his mother. For Mom, it was counseling and how she could help Ricky get used to his new arms once they went home. For Ricky, it was a lot of physical therapy. Practice makes perfect, especially with a new pair of arms. And practice takes patience. A lot of patience. But the therapist at the Shrine Hospital knew just what to do. With gentle insistence and encouragement, she showed him how to use his arms. You see, the care a child gets here doesn't end with new limbs or constructive surgery. These are just the beginning. And Ricky's story, like the story of all the children at the 21 Shrine Hospitals, is a continuing story of care and research. It's a continuing story that goes beyond helping kids to overcome their handicaps and to realize their full potential. It's a continuing story of people in Shrine hospitals and research labs working toward the elimination of all crippling disease. And it is a story that will be continued as long as there are Shriners dedicated to helping find the sources of these diseases and their cures.
Here's your new arms, Rick. You all set for them?
No.
You're not? Let's see how we're going to do. Oops, gosh, I missed your adjustment there, didn't
A new set of arms means another new beginning for Ricky.
Bring your elbow up. Bring it all the way up. Now lock it right there for me.
I can.
Sure you can. That's what. Now bring this one up. All the way. Whoop. Now lock.
They mean a lot of new things to learn, things most other kids take for granted, like buttoning a shirt. But Ricky will keep trying, and the people at Shriners will continue to help. Ricky is typical of the kids who are treated on an ongoing basis at the St. Louis unit, which numbers over 700 children per month. Admission is determined after an evaluation of individual needs. All services are free, paid for by the Shriners, just as they are for inpatients at the hospital. Outpatient care has grown enormously at all Shriners hospitals in recent years due to a change in the nature of the disease being treated and due to a concerted effort to treat more patients more efficiently and effectively. It not only frees up beds for children who really need them, it also frees up the children so they can spend more time with their families. Here in St. Louis, a variety of specialty clinics have been established to handle the growing numbers more efficiently. Frequency of visits varies according to the individual needs. Some children visit here once a week for casting. Others not more than once or twice a year to ensure braces fit and function properly.
Years ago, the children would send me all of their pictures, and I put them up in this track here. And when the children saw them, they were so impressed with them that the track became so full that I started putting them up on the wall. And they were very pleased to see their pictures up there. They always come and look for them. If they've given you a picture, you better have it up there.
Naturally, not all of these children can be treated as outpatients. Some must be admitted to the hospital for more intensive care or for surgery. But a difficult experience for the kids is made easier by the environment of community and family here. There's plenty of care and attention for the hard moments, and plenty of thought put into the efficient management of the space and schedules. And there have been some great strides in this direction in recent years. More operations are being scheduled. Children are no longer admitted far in advance of scheduled surgery. Outpatient activity and care has been expanded after necessary inpatient care Many of these children continue their treatment through scheduled clinic visits, like Ricky. All this means better use of the facility, and that means more children can be treated. There's another level of care that's shown exceptional growth at Shriners Hospitals in recent years: research. Work that is aimed at understanding and eliminating the diseases these children are afflicted with. Dr. Louis Avioli has been building that effort at this Shriners Hospital. He is also head of the Division of Bone and Mineral Metabolism at Washington University of St. Louis. One of the efforts of his special task force there is researching bone growth, remodeling and repair in individual children and family units.
When I first went to Shriners Hospital approximately 8 years ago, we were confronted with a number of children with a variety of metabolic bone diseases who were under the care of orthopedic surgeons. Their care was primarily that of reconstructive and remedial surgery. It soon became obvious to me that despite this management, we knew very little about the underlying cause of many of these diseases. Consequently, we put together a team of individuals to interface with the orthopedic surgeons with one primary goal, namely, let's look into the nature of this disease and let's try to determine why these children are crippled in the first place. Hopefully, with this type of study, we'll be able to plan more effective forms of therapy. Obviously, our research efforts would be constrained if it were not for the generous support afforded by the Shrine. We've been very lucky to combine our existing facilities with those of the Shriners Hospital St. Louis toward these research goals. We're now working very hard in an attempt to establish a full laboratory at the Shriners Hospital, which will continue the research which was established here. This research unit consists of 6 core laboratories as well as specialized procedure rooms to avoid duplication. We are presently studying 4 bone diseases seen at the Shriners Hospital. These are vitamin D resistant rickets, osteopetrosis, osteogenesis imperfecta, and hypophosphatasia. These 4 diseases share 2 common denominators. Firstly, they are all inherited. They run in families. Secondly, they present with crippling bone disease in the growing child and some form of bone disease, albeit less severe, in the adult. One of the problems which confronts all of us dealing with these children is why is it that some children in the same family may have a crippling form of the disease, whereas others may not. Similarly, adults may be very affected in one family and not so down the line in a related family. We must know why.
Dr. Aviola's work is just one example of the Shrine's continuing commitment to the needs of crippled children. In the past 10 years, the funding of research projects has increased from thousands of dollars to millions of dollars. And more orthopedic units are becoming affiliated with university medical centers, thereby expanding both research capabilities and resources for handling specialized cases.
There's no question that with the current advancement in medicine, there is a tremendous competition for the care of the child with crippling orthopedic problems. And the Shriners Hospitals not only are in that competition, but they've got to recognize and respond to that competitive need. There's a tremendous expanding opportunity that is currently going on in the field of medicine, especially in the orthopedic field, which demands greater expertise, greater knowledge, the formation of teams of discipline that can care for children with very complex, disabling orthopedic problems. Over the years, infection, tuberculosis of bone, poliomyelitis, and other formerly common problems have pretty much become extinct. With better obstetric care too, some of the things we used to see are not so common, but on the other hand, with the development of newborn intensive care units, many children with crippling conditions who otherwise would have died now live. And this has led to a whole new resource of patients which have very complex and demanding needs with which the average orthopedic surgeon, the average hospital, just does not have the knowledge or the expertise to handle. In order to respond, the Shrine hospitals must not only increase and improve their special facilities, but they must develop the personnel, the professional knowledge and know-how, and recruit and keep outstanding surgeons who can perform the necessary operative procedures in so doing. In the past, the Shrine hospitals have been very fortunate in having people in such stature, and even currently, for example, the presidents of the Canadian and American Orthopedic Associations consist of Dr. Richard Cruz of Montreal, the chief surgeon, and myself, the chief surgeon at Theatre Mount Union in Salt Lake City.
Since 1970 in Canada, we have had universal compulsory national health insurance. And this has meant many changes in our hospital. We have chosen to look at these changes as a tremendous opportunity rather than a disadvantage. We are still a traditional Shriners Hospital for crippled children. We accept and treat children in the traditional way, and we run our hospital with a board of governors the same way as is true of other Shriners hospitals. We have been able to conclude an arrangement with the government of the province of Quebec. Now, this has allowed the Shriners to devote a rather large sum of money from their own budget to the establishment of a laboratory for research into the causes of crippling in children. Our vision of this as a research center has from the beginning emphasized clinical research, because we've always felt that the closer you are to the patient, the closer you are to the cure. Research actually started here in 1974 with just Dr. Gloria and one technician working in a converted bathroom. All of our research activities are devoted to understanding the problems we see on the ward. We use basic research tools like biochemistry, enzymology, electron microscopy, or the like to help us understand the basic mechanisms on a cellular or molecular level. We hopefully then can return this information to the patient in order to either improve the situation, perhaps develop new treatments, or prevent the problem in future cases similar to those we've already studied. That's the philosophy of our research program, the use of basic science tools to eliminate human disease or disability. Dr. Robin Poole was brought here from Cambridge, England, to direct our joint diseases laboratory. He had already made several fundamental discoveries in the field of arthritis prior to coming to Montreal.
In this laboratory, we are particularly interested in the mechanisms whereby tissues are destroyed. In juvenile rheumatoid arthritis, we have a situation where the joints of these children are destroyed progressively to such a degree that they cannot repair themselves. We want to know precisely the mechanisms that are responsible for this destruction and why repair cannot normally take place. To do this, we've established a group of investigators, all of which are specialists in various aspects of the disease. Together we work with physicians, with orthopedic surgeons and other scientists to understand the disease so that we can help the patient in a specific and positive manner. In the last few months, we've been fortunate to discover that the body seems to start destroying itself in the child. This is what appears to be causing the disease as it affects the joint. So what we're doing now is to identify precisely how these mechanisms of self-destruction are mediated so that we can block them and prevent that child from being crippled and to prevent other children from suffering similar problems. To do this, we've assembled here equipment which is extremely specialized. Nelson Mitchell in this laboratory is concerned with using electron microscopes to understand the fine structural changes in the disease.
This is a transmission electron microscope capable of magnifying cells and portions of cells up to 500,000 times. That's about equivalent to studying a postage stamp blown up to the size of 10 football fields. In addition, we have the capacity with this instrument to study the chemistry of these very small particles.
Dr. Nelson Mitchell is an excellent example of a clinician who also works in a basic science discipline, because in addition to his research, he is a practicing orthopedic surgeon. Dr. Francis Gloria is the director of our research program. He is a pediatrician who has also earned a PhD degree in research.
Among the many diseases that are encountered in the children we see on the wards, we have elected to focus on those where the basic mechanisms are genetically determined. We've done that because we thought we had a better way to approach those basic mechanisms by studying pedigrees of people where these mutations, as we call them, are elicited. As an example, we have on the ward at the moment 2 girls with vitamin D resistant rickets, and we're following another one in the Chicago unit that we are seeing sometimes here. Now, this particular disease is genetically transmitted in a dominant fashion, and the people present as very short, like this girl here, with the new type of treatment we have devised because of the research we have been conducting on the way their kidneys were handling the phosphate load that was given to them. We found that we could promote growth rate as well as improve greatly the appearance of their bones, therefore correcting most of the reverse effects of the mutation they were affected with. Now we are going to add a new dimension to this work by studying the response of the bone structure to this form of therapy using light and electron microscopy. This way we hope to not only to better understand the disease, but also to have a better insight to the modulation of the growth process in children. This boy is affected by a genetic disease called osteopetrosis or marble bone disease, in which there is an excess of bone tissue that pushes out the bone marrow, leading to death by anemia or hemorrhage. Now, to understand that disease, we also have to understand how a bone will function. We do know that bone is a dynamic system that will continually build and destroy itself. In a healthy bone, this process is in balance. We were surprised to find in our 3 patients with osteopetrosis that there was too much of these cells which resorb or destroy bones. But are these cells active? We want to find out by challenging them with the hormonal modulators. By assessing the changes in blood calcium measured with this machine, we'll find whether the cells are responding or not. If we do get a response, then there may be a new avenue for treating those children. If not, there is nothing we can offer to them at the moment, and the answer we'll seek is still to come.
Dr. Gloria can't help these children if he can't reach them. But how does a crippled child find his way to Dr. Gloria or the other doctors in the Shrine hospitals around the country? It is the individual Shriner who searches out kids to bring them together with a cure. It is the Shrine Board of Governors who meet to approve patients for admittance to the hospitals, much like this meeting in Houston.
Well, Mr. Chairman, I'd like to recommend that our budget be adopted. This budget is in balance, and refer it until next month and take another look at it.
Is there a second to the motion?
Second the motion.
All in favor, indicate by saying aye. Aye. I would like to say before we close the meeting that I do appreciate all of you coming and the extent that you participated. It's been quite helpful. Thank you. See you next week.
This has been a good meeting, and as usual, we have made important decisions regarding such things as building and equipment, budget, and patient recruitment, among other things that Mrs. Ross, our administrator, needs.
The Board of Governors of our hospital gives me daily direction in the operation of our facilities, from the day-to-day maintenance of the building, to the proper financial allocation of our resources, to the direction our future research might go. In all this, they bear the ultimate responsibility for what we do here. On a day-to-day basis, I feel that I can call them at any time with any particular problem I might have. All Shriners are counted on to find children we might help here. The Houston unit is a part of the Texas Medical Center. Our role here is that of a pediatric orthopedic treatment facility. In turn, I feel very fortunate in that I can call on any part of this vast medical complex for any help we may need. One of the most beneficial relationships in this medical center is the affiliation Shrine has made with the University of Texas. Shriners provide funds for their genetic research as well as the facilities right here in our hospital for their work to continue. The importance of this to our kids is that they can provide family genetic counseling as well as crucial assistance in the diagnostic area. This lab is where some of the chromosome work is done. Here they can photograph patients' chromosomes. This helps us to pinpoint the exact cause of the patient's medical problems and determine the best treatment. A vivid example of the importance of correct diagnosis happened when an infant boy was brought to us for treatment. If his genetic syndrome had not been identified, the boy could have died. Before this lab was here, this level of care was not available.
The planning and decisions come together in an office like this, with a member of the Board of Governors, a hospital administrator, and the medical staff. They translate those things into care of a special kind. It's teamwork. This sense of working together toward a common goal, this sense of team spirit, pervades the Shrine Hospital network. In Chicago, it's been going on for 6 years as they have planned their new hospital. Dr. Gloria consults with Dr. Edward Miller, Director of Nursing Joanne Gorman, and Hospital Administrator Gene Yassel. Dr. Gloria's experience in putting together Montreal's research facility is invaluable in making plans for the new hospital. This free exchange of resources and information benefits both staff and patients alike. And this is true not only of the running of the hospitals, but more importantly, in caring for the children. And that's another reason Dr. Gloria is here, to work with patients. He brings with him his very specialized skills, all he has learned from his research. And he'll take back information from these children that can help him one step closer to finding a cure. Working together, he and Dr. Miller assure these children the best chance they can get.
In order to be sure that this child continues under good care, that it's going to take the involvement of the family. And in order to do that, we have to depend very much on our family-oriented patient care.
Joanne Gorman is in charge of a program of family-oriented patient care. That program makes the family a vital part of the hospital team, starting with admissions and extending right through treatment. This is important, as the support and care the children get from their families actually help them respond better to treatment. And so parents are encouraged to go to the educational sessions, to the holding room, to be with the children before surgery, spend time working with the children and the therapists. With all this in mind, the new hospital is being designed to include guest rooms where parents can spend the night. And so the old makes way for the new, for the better. The groundbreaking ceremony for Chicago's new facility symbolizes a willingness to change, to move forward, to work together, to improve.
That increase symbolizes the Shriners' growing commitment to tomorrow's children, a commitment to making each Shrine Hospital a center of excellence. At these centers, the finest in specialized medical care, plus the advantages of companion research programs, will be focused on the children of North America who need our help.